All right, good afternoon, everyone. We'll go ahead and get started. On behalf of the Southern Regional Disaster Response System, we'd like to welcome you all to today's webinar entitled 1 Year After the BioLab Fire, Medical and Public Health Perspectives. Before we get started today, we just want to address a few housekeeping issues. This webinar is being recorded and will be made available on the SRDRS website. So if anyone couldn't attend today, they will have the ability to see the webinar on the website. The chat feature has been disabled for all participants, so you will not be able to chat during this webinar. And we have also disabled the speaking mechanism, so everybody will be muted throughout the webinar. If you do have questions, though, there is a Q&A button that's at the bottom panel, typically where you would type in a chat. So you are welcome to put your questions throughout the webinar today. Feel free to go ahead and type them out as our speakers are speaking. You don't have to wait to the end, and we'll be sure to address as many of those questions as possible at the end of the webinar. Also, at the end, there will be a QR code so that we can solicit feedback. Also, as part of that QR code, we are going to be offering some EMS and pharmacy credits for this webinar. So if you are an EMS personnel or a pharmacist, there's some additional information that's also in the QR code that you will need to fill out in order to be able to get your CEU credits. Now I'd like to take time to introduce our moderators and our speakers. So I'll start with our moderators. So my name is Kurt Harris. I'm the director of the Institute for Disaster Management. I'm also an associate professor in the College of Public Health at UGA, and I serve as the executive director of the SRDRS program. My co-moderator and partner in crime, as always, is Ziad Kazi, a professor of emergency medicine and medical toxicology at Emory University, where he also serves as associate medical director. He's the assistant medical director for the Southern Regional Disaster Response System and the director of the Georgia Poison Center. Our speakers for today. Our speakers are Benjamin Franco, who is a federal on-scene coordinator with the U.S. Environmental Protection Agency in Region 4, where he has led responses to major disasters, including Hurricane Katrina, Irma, and Maria, as well as the Deepwater Horizon oil spill. With a background in chemical engineering, he brings over 25 years of expertise in managing chemical releases, oil discharges, and large-scale environmental crises. Tyler Lepechan is a U.S. Navy Lieutenant Commander and Emory Medicine physician, currently serving as a medical toxicology fellow at Emory University and the Georgia Poison Center. He has provided emergency and toxicology care in both military and civilian settings, with leadership roles in combat trauma research, disaster response exercises, and training of medical teams in the U.S. and abroad. Alex Isakov is a professor of emergency medicine at Emory University and executive director for health security. He also serves as a principal investigator for the Southern Regional Disaster Response System. He has decades of experience as an EM physician, researcher, and advisor to national preparedness efforts. Stephanie Hahn is a board-certified clinical toxicologist and director of the Georgia Poison Center and Grady Health System, where she oversees daily operations, training, research, and community outreach. With over 15 years of experience, she also serves as adjunct faculty at Emory University and Mercer University, teaching toxicology to pharmacy and nursing students. And finally, we have Robert Geller, a professor of pediatrics at Emory University and medical director of the Georgia Poison Center, where he has led clinical toxicology services since 1988. He has extensive experience in pediatric care, poison prevention, hazardous materials response, and hospital leadership roles across Emory and Children's Healthcare of Atlanta. We're grateful to everyone who was able to attend today's webinar. We're grateful to our speakers for lending their time and expertise today. And I will now turn it over to Benjamin to get us started. Thank you.
Thank you, Kurt. Appreciate it. Once again, I'm Ben Franco with EPA. I'm a federal on-scene coordinator. For those who don't know what a federal on-scene coordinator is, at EPA, we respond to hazardous substance spills and to oil discharges. And so we are trained to coordinate the response, make sure that either the responsible party is doing it correctly, or if there is no responsible party, then we represent the federal government at that spill, and then we step in to do the actual cleanup on that. So for this event, we had a whole bunch of different numbers of on-scene coordinators with EPA from our region, which is here in Atlanta, downtown. And we had close to 12 of us who were out there. The lead OSC, there's only one for each event. The lead OSC was Rick Jardine on that. But Rick and I have had experience with this facility. We actually were out there in 2004 when that was the first time that they actually had a big response there in Conyers. Next slide. I'm going to give an idea of what this response looked like to all of us when we showed up. Rick was responding OSC for this event. He was R1, and he shows up and he sees this plume with color and real thick. Next slide. And it's changing directions, going from one area to the other, hugging the ground. Next slide. And you have the fire department already on scene trying to put out the fire on that. Initially with a fire, and then it became a chemical plume from the reacting CCA. Next slide. So it happened early Sunday morning. There was an initial fire, and then Rockdale Fire Department showed up. They actually requested additional mutual aid from us counties nearby to help them out with applying water. Initial orders that are provided are by the Rockdale EMA. Normally that's who does the orders. It's not EPA. There were two types of orders that were given. One was an evacuation in the immediate area within maybe a 1.5 to 2 mile area. And then there was a shelter in place farther out, which covered almost a 10-mile radius. And that covered pretty much all of Rockdale County in some areas and into Newton and other counties nearby. Next. For those who are not in Atlanta, BioLab is east of Atlanta. It's in Conyers, Georgia, right off I-20, real close by. If you see that 12, that's the warehouse where it's 270,000 square feet of space, which was, that's what they call Plant 12. And that was their majority of the bulk chemical storage area. There was a separated inside there was a firewall in there where they had some of the chemicals in there. And then they had other chemicals that weren't water reactive or finished product in the other side of it as well. Next slide. Based on the Chemical Safety Board study that they did, they went out there and looked at what happened. You could pull that up, investigation report. There were 13.9 million pounds, and there are several of these water reactive type of chemicals on it. The biggest two that we had to worry about in this response was TCCA and then DCCA. We did also have some bromochloride products as well in there. You can see the super sacks to the right on the bottom there. That's kind of how they were stored. That's just a picture showing super sacks, but at the end, you'll see some pictures of when we went in and did the final investigation or inspection of it when we considered everything reacted. And you can kind of see how high up the super sack, but that's how they would look like when they were being used by the plant personnel. Next. Give you an idea of the timeline events. September 29th, there was a 911 call that came through. It was very early in the morning, somewhere around 6 in the morning. And from 6 till 4 o'clock, or kind of the noonish period of time, that first fire was put out. It was really what they considered fire on the roof, on the membrane. One of the things that the Chemical Safety Board, from talking to the personnel, what they thought is that previous to that, the personnel had noticed some chemical smells in the warehouse, and then the facility had implemented a fire watch overnight. Previous to September 29th, Helene came through, and I believe that may have caused some damage to the warehouse roof. Some water may have entered through that, and then on that same evening, early morning, that September 28th to September 29th, personnel that was on fire watch, they kind of started hearing some popping noises in there. So they suspected that some of the super sacks actually got water in them. Once the fire department came out, they started doing some door-to-door shelter in place when they started seeing the fumes coming out of the warehouse. And then they did that Plant 12 extinguishing, but then a second fire erupted. I guess some of the super sacks were actually causing it, that they couldn't extinguish. They tried to remove as many as they could out of the facility, but once the visibility became a problem, they had to stop that process. They did extinguish a second fire later in that evening, and then by 5:30 in the morning, that's when EPA showed up with our air monitoring, started doing air monitoring within the community at the site. Right, pretty much in that evening, by that night, the roof and all the walls have collapsed right on top of all the chemicals that were there in the super sacks, which caused even more issues for later on. So once that happened, the Rockdale County Fire Department and Fire and Rescue, really what they were looking at is extinguishing some flare-ups in that debris on there. But pretty much at that point, the fire was over, but it still was a chemical fire because of the TCCA and on that. We were busy from September 29th through October 17, EPA doing community-based air monitoring, and the BioLab company representative, they also had some response contractors out there treating the TCA and also providing air monitoring within the site for health and safety, and then within the community as well. Next. So here are some of the objectives that we had and what we did initially on the first day. Our EPA, we always establishes a unified command with the responsible party and local whenever we can. We want to make sure that we have everybody on the same page. It's important to have that. And these were the main representatives within the unified command on that. Next. Once we established that, we also started doing air monitoring. Chlorine was our first chemical of concern, our main one. We also had HCl because chlorine, when it goes into the environment, and especially in this type of, it mixes with water in the air, moisture in the air, and you might be able to have some HCl or acid, hydrochloric acid in there. Also with fires, phosgene could be a secondary product. We did not see that at all, so we eliminated that from our testing in the air on that. We were using regular air monitors, not samplers, so these were real-time results that we were getting on that. Early on to the response, we set up a public page which showed our real-time data. We actually got data from the BioLab contractors as well within the community, and that data that they were taking or getting from the community, and also put that in there as well. And then on a daily basis, we also provided air monitoring data to the unified command so they understand what was going on outside of the fence line. Things that we requested, we needed to use get some better pictures from overflights as well. So we brought in the United States Coast Guard Ghost Strike Team and their drone, and they provided pictures for us. We also started a JIC, Joint Information Center, with the Coast Guard's assistance and with the county and EPA, so that we could provide timely news releases. We also have what you call the TAGA, and that's we'll talk a little bit further now, but looks like a bus, and it actually it's a lab on wheels, and we use that. And our wonderful friends at ATSDR helped us a lot with the interpreting some of this data and coordinating with our state and local public health partners on reviewing data. Next. So things that, we call it fighting the dragon because it really was kind of looking like a dragon. You see it, how it's fuming. Every time they disturb the soil to move it or the debris, it broke up somewhat the crusted chemical because it would crust over. But once you broke that, it actually reacted with the moisture in the air or any other moisture within the soil, and then started fuming. So we early on we stopped water application. That helped with water runoff. In 2004, we put a lot of water, or the county put a lot of water on that response, and we saw a heavy impacts to a nearby lake called Veterans Lake, BFW Lake. We did not do that. Early on, water was not applied. They actually very quickly they closed any of the creeks that were going into that lake. So the impacts to that lake was very minimal compared to what we had in 2004. Those are kind of some of the lessons learned that the company implemented as part of their response plan. Things that during that period of time is coming up with some type of treatment plan and how to reduce the off-gassing into the community while they were doing that, the removal and the remediation on site. And our biggest challenge was really trying to do that air monitoring over such a large area. As I said before, we had two separate areas. We had the fence line, which were for worker protection outside of the fence line, which was right in the immediate 2-mile zone, which was there's a evacuation, and then you had a shelter in place outside of that 2 to 10. And so we had a really large area where we had to come up with and determine what were the air monitoring values in those areas. Next. Here are some of the resources that we use for air monitoring. To the left, we have our EPA star contractor. They work for us. They were doing air monitoring. If you see the yellow tape, and you could faintly see some tubes coming out, our instrumentation inside. The tubes were sticking outside of the truck, and we would just go to different locations outside or inside the evacuation zone and outside the evacuation zone and take readings. And so they could stay there maybe 5 minutes. If they weren't seeing anything, they would go to another location. And it was all based on, we'll talk a little bit further on, but based on atmospheric conditions for the day, where the wind direction was going. And if it was at night, there would probably be an inversion layer and we'll drop some of that. So these operations were happening during the day and they were happening during the night. So we had 24-hour. We did have a fixed air monitoring stations around, and we had up to 11 stations. And then our Targa bus that you see below, that's what we used outside in the from the 2 to the 10-mile area there where the shelter in place was done. We tried to keep this, the Targa, in an area that was very low. They were possibly low. Because it's a laboratory and it's on wheels, so it gives us very low values. And also is that we didn't want to put it in an area that it could be overwhelmed by the chlorine, and impact the instrumentation. But like I said, it's a lab on wheels, so it's very sensitive to high values. Next. These are the two instruments that we had. The SPM Flex, that's the chemical cassette that you put inside. These were what we used for hydrochloride and in the phosgene. Initially, we used phosgene, then we removed it after not seeing anything. And then we concentrated on the HCl. And then our Air Array Pros, we use that for the chlorine, and then H2S and LELs and VOCs on that. But all this information goes into a common operating picture wirelessly. And then we showed it to incident command there. Not only we did that on a real-time basis, and that went into our website, some of it, obviously one of the things that by doing real time is that it didn't allow for too much quality control, quality assurance on our data because it was real time, and we had to kind of have a disclaimer on that. Next. But, and here are the kind of one of the action levels that we were looking at on that. So we normally, when we have emergencies, we use our Eagles, Eagle 1, look at a 1 hour period if someone was outside in a 1 hour period in the plume. And these were the values that we looked at. Obviously, 0.5 is red for 60 minutes, but really 0.5 was the same for all of them. And so that's the reason why we went with Eagle 1. It goes from Eagle 1 is the least that you're going to get impacted to 3 where you're really getting sick or heavily impacted on that. And so you'll see that 0.5 all the way up to 20 or 50, those values are, and these are all in parts per million, all these values are pretty high there up in the Eagle 3. They're pretty high. One of the problems that we had with chlorine is that it has a very low odor threshold. So, at 0.2 and 0.4, you're going to smell it. And we did get a lot of calls into our office and into the county from all over, including Atlanta and further out in areas where they're smelling the chlorine, which that made it even more difficult on the messaging part. But in most places, we didn't really get a sustained outside the immediate area of the where we were at. We didn't get a sustained higher than a sustained 0.5. In that more than 2 miles out, you might get a peak and then it will drop back quickly. And our averages were below our action levels. Next. So here's, hopefully you can see that a little bit here, but this kind of every day, we could, after 12 hours, we would provide a daily data summary sheet. Now, this one actually had been a quality control QA QC. And the reason I say QA QC is that when we put in data real time, that might include some peaks due to issues that we may have with the monitors. They may have some issues with calibration, and we may have to bump calibrate or calibrate, and that shows that those peaks will show up in the instrumentation on real time. But here with our review of our data, we actually take out some of that data out of there. So if we know there was an issue with the instrument on that point, we calibrated and VOCs were very high because we calibrated, we will take that out of it, or we would put an asterisk explaining why those numbers were higher. So all these were QA QC. The reason why I show you Station 8 versus Station 6 is that these were right on Old Covington Highway, which actually was the road that goes just north of the BioLab Plant 12. Station 8 was west and of the plant, and Station 6 was east, and it was just maybe a quarter mile less from the entrance or from the building. But if you look at the difference, you could tell the difference in values based on the wind direction. So if you go on the second one, all the way on the bottom, you can see that 0 to 1.7 and 0.19, that was on the east side. The wind direction was going in that, in that direction of that monitor, and we were seeing higher values than up on the first one that says Station 8. So, our instrumentation was actually tracking the atmospheric conditions and the plume that we were seeing in the ground. Next. So other things that we we used during this response. We requested modeling from IMAC. That's a federal resource that we could request through the federal, or even a state could do that. EMA could call it in. And what we used it for was really for two things. One is to the wind direction, and model it over a period of time. And then we also looked at it for height and mixing height. What we noticed is that during the day, the plume went up into the air. You could see it at 6 o'clock where it got really warm. Once again, it was October. Luckily, it didn't rain, but we did have, during the day, we had some nice warm weather. And then at evening, it got cold. And then all of a sudden, you could see at 10 in the morning where it still hadn't gone cold, warm, where you could see on the first slide, all the way on the right, bottom right, you could see our stack height. And you can see how it was actually hugging the ground. And then later, as it got warmer and warmer during the day, and at night, before it actually, the inversion layer got into place, you start seeing how it starts all the way to the right at 8, let me see, that was at 10 o'clock at night. You start seeing how it's starting to hug down and come down to the ground. That really impacted at night the areas around it. And that's why you would see this emergency alert that would come up. The emergency alert actually was geocoded. So every time you jumped, you crossed over into the county. I was surprised when I would come in a couple of times for the night shift. I did night shift, and then later on, I got moved into the day shift. It was interesting that once you crossed over into that area, you would get that on that. Now, next. Here's some of the data. We got the data from the state, from the contractor, and that kind of allowed us to see if they were having any issues remotely on the roving group. Next. Here's a decision tree that we had for alerting the local EMA. And so we had our action level for chlorine was 0.5. And then we would let everybody know who to contact and who to call. And if they needed to institute, you see in the box up there where you see the action levels and what they would require. Either depending on what level you would entertain implementing a shelter in place or an evacuation on that. So the night crew actually had this because they're the ones who had the greatest chance to actually have to implement this. Next. Health advisory group was set up, and we had all these groups. I appreciate everybody's effort. They reviewed our data, and they were really instrumental in recommending the lifting of the shelter in place, especially the one that went from 2 to 10 on that. They were really good at reviewing, and if we thought we didn't have enough information, we would go back and try to get it whatever they needed out there. The Taga bus was really instrumental to make sure that we have a confidence on our data in that area outside of the 2 miles zone. Next. Give you a quick how it is. October 7th, that's when we were able to bring that shelter in place from the 10 to all the way down to the 2 mile radius. And then, on October 17th, that's when we Unified Command make the decision that all shelter in place and any evacuations could be removed. There were still some evacuations really close to the facility, but that was just to ensure that people were coming back in. They were coming back in safely as well on that. But normally what we're looking at is air monitoring data below our action levels. We were confident that there were not going to be issues. And then back at the site where they were doing the cleanup, they were not showing any fumes coming up and any plumes coming out of while they were doing any activity out there. Next. This is why it took us so long. Down on the bottom, it shows you how on the debris where the walls had fallen, you could see that Rockdale did some drone work with their infrared camera on it, and we could see the hot spots out there. So even under the debris, we could see those areas, and every time we disturb those areas, it would actually start fuming, and you can see it up on top. Every time they move stuff around, and then you all the way down to the right corner on the bottom, you see where we had a treatment pool, and every time the equipment, the debris, TCCA, soil, whatever was mixed with, got treated, got sent to that pool. Next. Give you an idea how those panels, they were lifted and put out of the way so that we could get to the TCCA that was under it. And all of these were done carefully. Every couple of days, they were tested to make sure that when they went through it, it wasn't going to cause any really heavy fuming. And then once it did that, they only did a limited amount during the day. Or everything was done during the day, nothing at night, due to the fact of the issue of having an inversion layer. We really didn't want to have any gases being put out there, especially on I-20 as well. Next. That's the fume when we were, not we, but the contractor for BioLab. They were steering the TCCA that they were grabbing from the debris pile, and then they would put in these frac tanks for it to. So basically, TCCA is used in pools. That's used as a algicide, sterile disinfectant for the pool. And basically, we were doing the same thing. The problem is that you use very little TCCA in a pool. Here, we were trying to do it as quick as possible. And so we had these frac tanks that were actually, we had to make sure that we didn't overwhelm them so they wouldn't start fuming as well. Next. Here's another example of it, and another one as well. Next. And then here's a pool that finally, some of that liquid from the frac tank were sent over there so they could further get treated before it get put in frac tanks on the other side of the facilities. That then it was sent to a wastewater facility outside of the facility itself. So therefore, final disposal. Next. This is kind of how the debris looks like. Metal that was all recycled. They checked it for TCA, make sure nothing was going to react outside of the facility. Next. And here's kind of how the look of all those super sacks and how they were in the facility. These were non-reactive, but they made sure that they picked those up. These weren't the TCCA type, but they still could react if they need to. Okay, next. Here's another example of how some of that had reacted already or melted on that. Next. So at the end, we looked at 18 days of activity out there. We had people with shelter in place, and obviously that impacted a lot of the businesses in that area. But it had to be done to protect people. One good thing is that we did not have any fatalities or any real bad injuries associated with it. Obviously, there's always someone getting a toe stubbed or something, but nothing that we had issues out there. Obviously, we know that in the press, there's a lot of lawsuits pending with the company on that as the next thing over the past year since that site. My understanding that BioLab is no longer processing any of that TCCA at the facility out there. I think that was the last one. Next. Yep. Thank you.
Thank you very much for that excellent overview, Mr. Franco. If you go to the next slide, I'll kind of progress us forward from here. Again, this is a standard disclosure. Before I begin, I am an active duty United States Naval officer. These are my thoughts and opinions alone, do not reflect the United States government or the armed service. Next. So these are the objectives that we hope to do at the end of the webinar, that we should be able to describe the BioLab fire incidents, the medical effects of the exposure of chlorinated compounds, and discuss the public health considerations associated. Next. As a reminder, these are our speakers and moderators today. And next. They do not have any conflicts of interest to disclose. Just to kind of bring you into where we are in the outline, we've again done that excellent recap of events, and now we're going to move forward to the SRDRS and Poison Center response, and also talk about some of the medical and public health perspectives. Next. So this is just a reminder that chlorine gas and other chlorinated compounds are considered high to intermediate water-soluble compounds. So this means that shortly after exposure, these chemicals interact with water in the mucous membranes of the upper airway and eyes, causing symptoms. While these rapid onset of symptoms tend to mean that these exposures are easily detected and escaped, serious injury can occur if there's high enough doses or if the patient is unable to escape. Next. So now I kind of want to turn to SRDRS and who jumped in and see how they could help with the medical and public health response to this incident. And I'll turn to Alex Isakoff, the principal investigator for SRDRS Region 4 and the section chief of pre-hospital and disaster medicine section at Emory University to discuss the SRDRS response to this incident.
Hey, Tyler, thanks. Hi, everyone. Just for those that don't know, the Southern Regional Disaster Response System is funded by HHS ASPR. It's part of the Regional Disaster Health Response System grants, and we're one of 4 regions that are in place primarily to assist with mitigating surge of patients in an effort to reduce mortality at health systems that might be operating under surge conditions. And part of the resources that we have, the Southern Regional Disaster Response System, is really outstanding clinical subject matter expertise, as well as health systems operational expertise. In this case, we really leaned into our clinical subject matter expertise with the goal of bringing really just-in-time clinical guidance to frontline healthcare personnel for what they might expect to see as it relates to patients exposed in some fashion to the noxious elements that were in the air, and provide some guidance about how to assess them, what treatments might be effective in managing them, and really describing the spectrum of clinical presentation from mild irritation to perhaps more serious injury or illness. And we really were deliberate about operating in our kind of very specific lane and not to get outside of that. We didn't have the information that our colleague Ben Franco shared in real time. We had some understanding from the EMA about what noxious chemicals were likely to be in that plume. And our goal really was to focus on clinical manifestations of exposure so that frontline healthcare personnel, wherever they might be, in affected emergency departments, primary care clinics, urgent care centers, would have the resource that SRDRS was providing in real time within 24 hours to have a live webinar available for presentation and then Q&A on management of people that might have been exposed. And we were, again, deliberate not to steer into the lane of the Emergency Management Agency and other authorities that had responsibilities for communicating with the public about contents of the plume or about taking safety precautions and safety measures. Our target audience was frontline healthcare personnel. And it was through our relationship that we have with the Georgia Poison Center and our friend Dr. Kazi and other colleagues there that we're able to quickly provide the clinical subject matter expertise to address those objectives. And I'd say more broadly, in the 8-state region that SRDRS works with partners to address, the Regional Poison Control Center Collaborative is another example of working together across 8 states to bring really robust capacity for clinical consultation to bear across the Southeast wherever it might be needed. So that's my high level of how SRDRS stepped in to provide a resource for frontline clinicians in this case. And I'll go ahead and cede my whatever time I might have remaining to the next speaker.
Thank you so much, Alex. So now we'll kind of discuss the Poison Center response to this incident. And if you can actually go back to the previous slide, the Poison Center fairly quickly was able to stand up a hazard assistance line that was able to capture over 3,000 additional calls related to this incident. So as you can see here, this was widely publicized both on traditional and social media, and they had a separate line for this with the options that you can see here to get stock answers about information and then quickly reach a spy to talk about either get more information or to report symptoms. If you go to the next slide. This is a heat map of the total case, the total cases spanning from the date of the incident to March of earlier this year. You can see that the majority of cases came from around the BioLab fire site, but there were far-reaching calls from all across the state. In total, over 1,000 exposure charts were generated regarding this incident. Next slide. Of the 142 information charts that were created, the topic of most questions obviously was health concerns. So people who had asthma or were pregnant or had these other pre-existing conditions wanted to know what they should do or if they were safe in their current environment. A lot of people called about air quality and exposure, what to do with their pets and their vegetation. For example, is it safe for me to walk my dog for 5 minutes? Or what do I do about the plants that are growing in my garden? Are these safe to eat? And then others focused on protective measures. Should I wear a mask when I go outside? Do I need to stay inside the entire time? Should I turn my air conditioning off and things like this? Next slide, please. So you can see here in the total exposure calls with a humongous spike on October 1st when the site went live, obviously. 450 cases entered into ToxSentry alone, just related to BioLabs. The volume rapidly declined after that date, but remained elevated through the first half of October. And a handful of calls continued into November and even some into early of 2025. Next slide. So you can see here, this is an overlay of the number of calls versus daily call volume from the previous year of 2023. And you can see normally the Poison Center does about 200 calls a day. And then now you add on these 450 calls on October 1st, and it made for an extremely busy day at the Georgia Poison Center. Demographically, the calls had a 2-to-1 female predominance, with 644 total calls coming from the 20 to 64 age demographic. Less than 100 of the 1,189 calls were pediatric cases. Next slide, please. You can see here the calls broken down by management site. As you can see, most of them were managed at home. Of the people who were managed in the emergency departments, very, very few of them were admitted to the hospital. And most of the time, they were calling from the emergency department when the patient had already self-presented. Only 188 cases were referred to an emergency department from home. And as as Mr. Franco mentioned, there were no prolonged stays or deaths. Next slide. You can see here a breakdown of the symptoms, which kind of like as we talked about with the pathophysiology of chlorine and other chlorinated compounds, makes sense. The vast majority of these symptoms were upper respiratory in nature. Next slide, please. So what's really interesting is that we were actually able to collect follow-up data on all of these calls, or not on all of these calls, but on a fair number of them, 39%, which if you know anything about poison centers is an absolutely exceptional feat. As you can see, the follow-up data, a number of callers mentioned yes to comorbid conditions, 184 in total. And then you can see some of the treatments they mentioned on the right of things that they tried to do to alleviate their symptoms, including taking a shower, eye drops, or fresh air, going to a place that was not in the plume area. If you go to the next slide. So you can see here, this is a breakdown of medical outcomes from the follow-ups that we did have. So the average time from exposure call to follow-up was 3.8 days. You'll see the one major effect that was coded here was actually from a mom who called after finding her son who had worked outside during the day, and he was in his home, weak and lethargic. He was referred to the emergency department, but was lost for follow-up. So it was unclear if this was related or what ended up happening to this patient. But as you can see, the vast majority of these were minor or moderate effects on follow-up. Next slide, please. So before we go into the lingering health complaints and environmental concerns, I'll turn first to Stephanie Hahn and then to Robert Geller to talk about talk more about the poison center aspect of this. So Stephanie, if you can go first, that'd be wonderful.
Yes, thank you so much. Yeah, so when we kind of shifted gears a little bit more towards the role of poison centers here in these types of emergencies, and we often can be or often are the first line of defense in identifying unusual exposure patterns. We sometimes can be the early warning system. We have protocols for this in our poison center, where when we have detected a number of very similar calls about the same type of situation or same symptoms, we have some internal alarms that will go off to alert us. We have protocols that will get other people involved, other toxicologists, other administrators of the poison center. And then we also use our collaborating efforts with the public health and emergency preparedness agencies within the state of Georgia and or Atlanta to also get them involved as well and let them know. And that's exactly what happened on that Sunday morning. There were, of course, what also happened, which helped us was there were news reports that this was going on, which helped us at least alerting our poison center, hey, we may get calls about this. And then from there, we absolutely did. But poison centers, can also serve as a real-time data collection from both the public and healthcare providers that we can kind of also quickly signal a cluster of symptoms or exposures. During the Atlanta BioLab and last year, our call logs and coding kind of flagged some concerns or provided maybe even some reassurance before broader systems kind of had mobilized. Just real quickly, I'll talk upon just the key challenges that poison centers might face in these type of situations. And I know Dr. Tyler went ahead and kind of touch upon this a little bit on some of the call data slides, but it's call surge. Our call volumes can spike tenfold in a matter of hours, especially if the event is being covered by the media. And we certainly saw that the very next day. I think, again, the event happened on a Sunday. By Monday, it was hitting the media. By Monday, the poison center was being used as a reference, which we were very fortunate that information was placed out there. But man, did we get busy. And so trying to staff and making sure that we tried to answer as many calls as we possibly could with the current staff that we had, try to manage burnout, which is a real thing, was real challenges in between, those first couple early days that we were managing this exposure. Which also then led us to let's go to Monday night into Tuesday. We said, hey, we need a backup line. We need a line where we can help minimize the surge capacity that we were experiencing, a place where we could put factual FAQs on where people could listen to those FAQs. Maybe that's all they needed, but still give options to where if they needed to speak to a human, they could. And so we provided a separate line for the media to start running that really helped with some of that call volume and call surge. And the other big key challenge that we face that I want to bring up, and it's definitely a buzzword these days, is misinformation. I think social media can certainly amplify rumors, Callers then may repeat them. And so it does require some careful, evidence-based reassurance when a poison center is involved in a type of an event like this, that we can try to provide proper information, accurate information, hopefully education that somebody on the other end of the line is going to listen to. You saw some of the slides. A majority of our callers from the lay public. Majority of the callers, fortunately, were from the lay public versus healthcare professionals. And so, meaning, not everyone had to go and seek medical care. So they were staying at home. And so we were able to hopefully provide them not just reassurance, but also evidence-based and appropriate and accurate information as to what they could potentially do while they were sheltering in place at home.
So from my perspective, the need became evident that there were people with healthcare concerns who needed to talk to somebody about their healthcare concerns. And although our emergency management strategies and our joint operations centers and joint incident command do a great job at many things, addressing individual health concerns is proven to be not one of them. And so the Poison Center in Georgia has historically maintained call handling capability to set up special lines that can allow people to call, and we can dedicate resources to that to the extent feasible. Maintaining dark phone lines that can be activated at the throw of a button has proven to be useful in many circumstances, and that's our strategy. We have automated call handling capability that would allow people to get timely messaging and information, as Dr. Hahn mentioned, and then try to minimize the number of people who actually need to talk to a live person to answer the same question again and again and again, because there is a finite limit to how much you can add people, even when you have technology available to let them work remotely. So thank you for your attention, and I'm happy to entertain questions later.
Thank you, Dr. General. Thank you, Bob. And thank you, Tyler, for taking us through this webinar. I'd like to add a couple of comments related to the Poison Center, as well as a regional disaster health response system like SRDRS. I think we are here to support any medical or public health need of the community, the state, also supporting our federal and state and local partners. One thing that I learned from this incident is the value of really potentially incorporating a resource like the Georgia Poison Center or a Poison Center, as well as a resource like the SRDRS or an RDHRS earlier in the in response to a chemical or radiological incident. Because initially this response is led by the Environmental Protection Agency, as well as the state or local EMA, depending on the state you're in. And then whenever the public health needs are recognized, this is when the public health system comes in. And then at that point, there is a little bit of a lag until you bring in your partners like the Poison Center, as well as these RDHRSs. I hope that in the future, we'll be able to, number one, bring in the public health system almost automatically, because these incidents, most of the time, will have some public health impact. So predicting that, getting that on Sunday, for example, in the future, in another incident, because the Poison Center would start getting calls anyway. And we've learned that also in the East Palestine incident, that there may be an unnecessary delay in bringing in the public health and resources like SRDRS and the Poison Center. Also want to recognize that any of these incidents, we should know this by now, will have lingering health effects and concerns. People are the public is really impacted by a stressful situation, especially if they were evacuated or sheltered in place. People also, as Benjamin said, the chlorine is a double-edged sword. It's easy to detect, which is good for safety, but it's also bad because people will detect it and feel exposed and could become concerned even at levels below the Eagle 1, which is our threshold for initial concern. So it's completely understandable and expected that the public will have concerns, and these concerns will be lingering, and we need to be ready to communicate to that public. So the more we know, the earlier we start working on this, the better a poison center is capable of collecting data, flexing up the staff needed to collect data, and also potentially collect health data as a long-term follow-up, bringing us here to the idea of a registry or of a population monitoring plan after a large emergency. So if this was a need for a registry here after the incident, that the health department would be leading at that point, it would be important for the poison center to be able to flex and support with appropriate questionnaires and the technology needed to collect this data and analyze it and share it with the stakeholders. The medical toxicologist also plays a role in this. In our clinics, we have outpatient clinics around the country that specialize in assessing exposures. I personally had the opportunity to assess several patients reporting exposures to this incident. And we often have to look at the exposure route. Was there enough dose? Where were they located? How long were they exposed to? What did they do when the exposure was happening? What symptoms they are having? What symptoms are directly related to an exposure to the chemical in question, and what is not related? And most of these complaints are usually not related directly to the chemical, but maybe certainly related to the stress reaction, to the involvement in the incident. And we play an amazing role here as a medical toxicologist in alleviating this concern, educating the public, and if needed, obtain necessary tests. In this case, we are fortunate that the air concentrations of the chemicals were below the Eagle 1 in most cases. And there were no sustained levels or above the Eagle 2 for population that is in the community. So I think this was really reassuring for us. And also, this chemical was fortunate that this chemical is not to consider, for example, to be a carcinogen. So that's also good news. So, but we may not be in the same situation in the future where the chemical is a carcinogen, and when there are potentially health effects that are possible or plausible based on the exposure levels. So, this is more of a call for us for the future. And, there will be a lot of people asking questions. There will be a lot of people measuring levels of chemicals in the environment, also being able to support the community in understanding how these levels are obtained, the limitations in measuring levels randomly in the environment. What do they mean? What was the baseline level before the measurement was taken? All of these should be expected in an incident like this, and we should be preparing for these ahead of time. I know, I'm sorry, I went a bit too long, and I'd like to ask people if they're interested to stay for another 10 minutes till 2:10 p.m. Eastern for a Q&A that I will moderate with Kurt. Thanks again for all our participants and our speakers and moderators, but let's now turn over to the Q&A.
So before we do that as well, don't forget about our survey here. So please scan the QR code and be able to complete the survey. All right, so to get us started with questions, Ben, I think the first question is going to be for you. It says, is the number, and that's 800-222-1222 for poison control, part of your incident command structure? When was the poison center notified of the fire and possible exposures for the shelter in place?
I guess the Poison Control Center was notified based on the calls. We did not call it into the Poison Control Center. We did bring in as a resource later on to Unified Command as part of our environmental unit that we had within the facility, our GIS unit, environmental unit. And so, no, that 1-800 was not, but it did get incorporated with some of the information that was going out by the county on that. Over.
Zia, were you going to chime in there? So I said you wanted to answer live.
No, I was gonna. Well, that was it. I was just saying that Benjamin was gonna answer live,
Okay.
but I think I echo. I think the Poison Center started receiving calls on Sunday, but I also hope in the future we can be better integrated up front in these responses. I think we can play a supportive role a useful role. The earlier you get involved. I don't know, Bob, do you, Stephanie, do you echo that sentiment?
I agree. And I just want to also remind people, because poison centers are located all throughout the country regionally. So if we're, it's about one poison center per state. There's other states that have none. There's other states that have multiple. But we advertise that our national number be 1-800-222-1222. I think would be one number that I would want everybody in the country to go ahead and place in your cell phones or in your phone systems, because that's one easy number to always remember. No matter where you are, you will get to a poison center. But for some local protocols, we often will try to provide a local number as well. So like a local area code. So we can guarantee that call definitely coming to us. If you recently moved into Georgia from California, for example, and you're still using your cell phone, if you called 1-800-222, you may, not always, but you may get routed to another poison center. So we like to make sure that we work with local agencies and also providing them a local number for these type of events as well.
Thank you, Stephanie.
So we have
go ahead.
tried very hard to work with emergency management agencies to be integrated early in the response, even if we're not necessarily needed to do anything, so that we are in possession of the latest data and don't wind up having to do extensive research to answer a question that comes in real time. That sometimes happens and sometimes doesn't. But it's been shown to be valuable in multiple jurisdictions, including both EPA regions 4 and 6, which have developed working protocols, working appendices to incorporate the poison center into emergency response. However, it is not necessarily the standard of care.
Thank you, Bob. I want to point people's attention to the Q&A box. There are some good answers there. One question I want to highlight was about the eagles. Based on that information about the eagles, is it safe to say just because you smell chlorine in the air does not necessarily mean it poses a danger? And I think, yes, that's correct, because the odor threshold for chlorine is below the lowest eagle level of 1. I think Benjamin mentioned that briefly. You may have not caught it, but you smell it, and that you could be exposed to levels that are not considered causing any effects to health. And certainly, if there's any effects, even at above the Eagle 1, but below the Eagle 2, these will be reversible, especially when you move away from the environment. So that's important for us. This was really important for me as a physician, as a doctor, taking care of patients, knowing this data. And these are the questions that I was hoping to get more information on. And that's where I think we could benefit from being part of the emergency management structure to get this data, be able to ask some questions. We had some questions about the type of detectors that they had, what were they measuring, what were they not measuring, because people were asking, and the more information we have, the better we can do in providing sound medical advice. But in any case, we do have strong relationships with our state and local public health and emergency management agencies, which allow us the benefit of communicating with them directly. And I know we did, but I just hope, not just for Georgia, but for the entire country, to really have this automatically included in a response structure, not have to rely on a personal relationship or an idea in the moment, a need that arises in an emergency. Having this preset, I think, would be a good idea. Also, Dr. Frank Walter, a colleague from Arizona, asked a good question about the frac tank. And then Benjamin wrote a nice description of what a frac tank is. There's also a nice question about poison center data overlaying with the plume model. I don't know, Stephanie, do you mind mentioning that again? Because I think that's an important question.
Yeah, I'm just trying to remember my answer. Okay, there it is. The zip codes that we collected, in our conversations with the callers that called during that week, we the way that we collect information, we verify that they are most likely calling from their home, or they were calling from a hospital. But again, majority of our callers were calling from home. And so when we continue to collect information about the patient, about their age, and their phone number. We verify their phone number. We collect their zip code. We do not collect full phone numbers, or sorry, full addresses. We just collect zip codes, to start at least. We don't have many poison centers in the country. I can't think of one of them that have geo tracking technology with any of our call center technology. So many of the zip codes that were collected from where they stated where they were living from. So of course, yes, we saw more calls coming in from that Rockdale, Conyers area, those zip codes in the surrounding areas, more than we did in North Georgia and South Georgia. And going back to that heat map, not that we have to go back there, but if you remember it, there was maybe one or two calls way up in North Georgia, maybe a couple calls South Georgia. I remember getting a call from Savannah, and they lived in Savannah, but they were calling about a previous exposure they had in that area. And that means that they were most likely working in that area. We talked to many truck drivers in the area that, just driving through there. I mean, I think anyone that had to drive through that area on a daily basis, definitely it filled their car for a while. And they may have had maybe lingering headaches, or they were just calling again because they wanted to talk their symptoms out. So going back to the question of, did we see an even district call volume? I think we saw more call volume definitely in and around the areas of where people lived, because that's where they lived. That's where they had the most exposure.
Thank you, Stephanie. And then one last question. I don't know if anyone can answer this question. Was there a patient tracking system in place during this event? I mean, outside the Poison Center data collection tool?
Yeah, I mean, outside the Poison Center data system, I was going to ask our other speakers if they had any other type of tracking. I don't believe so, but the Poison Center obviously did.
Health Department. We don't have anybody with Rockdale County Department of Health to see. I don't know. Benjamin, do you know?
I do not know. I would think that Poison Control is the only source.
Okay, and unfortunately, we don't have Rockdale County to answer this question. And there were some questions also sent about, the building and all that. I think those are outside the scope of our webinar, so I apologize for not being able to staff those questions.
Which one was it? I
think there was a question about a building. What happens with the building?
And I know one thing. I think there was a question about, is this facility going to be up and still going to be doing this type? It looks like they're not going to be manufacturing. If you saw those big super sacks, they were taking that material and then converting into those tablets that they would put in those, those pool duckies that you would see floating in a pool, or into the super shock powder that you would throw into your pool to take out the algae and make it nice and blue. And so they're no longer going to do it. It looks like all they're going to have at the facility for distribution. And so wherever they do that process, they're just going to bring those tablets and those powders already in the 5-gallon bucket containers that are closed. And I'm sure that that's going to be better protected than having the super sacks one on top of each other.
All right, everyone. Thanks for staying with us till 2:10 p.m. Thank you all for participating as moderators or speakers. This will be recorded and made available on our website. Give us maybe a few days to get this done. Fran will take care of that for us. Please remember to complete the survey. If you are a pharmacist or a paramedic and need your credit, you can get that thanks to our partners who provided the CE. Unfortunately, we don't have CME or nursing credit for this. And we promise you to come back with another webinar relevant to our current events in the near future.